Here's today's Genesis Medical Moments.
We are continuing our conversation today about breast health with Dr. Stork. Dr. Stork, surgery is not a one-size-fits-all treatment option. What do you recommend to patients who might be leery about getting surgery?
Sure. So breast cancer surgery kind of has a bad reputation because it can be pretty disfiguring, or at least that's how it used to be. We've come a long way since then. I use what are called oncoplastic techniques, meaning I'm focusing both on the cancer as well as the cosmetic outcome. There are two general options for breast cancer surgery. One is a mastectomy, where we remove the entire breast, or a lumpectomy, where I'm removing just the cancer and leaving the rest of the breast in place. So options for a mastectomy are basically, I'll show you here, going completely flat. So we would remove all of the breast tissue through an incision that goes around the nipple and the areola, and include as much skin as needed to give a nice flat surface to the chest wall. The other option is to get reconstruction. That can be done either using your own tissue or placing implants. So most often it will be an implant reconstruction. That's the most common that we see. In that case, we can do a skin sparing mastectomy, which means I remove just the nipple and the areola, remove the breast through that opening, and then leave the rest of the skin in place. There's also an option for a nipple sparing mastectomy, which means that all of the skin, the nipple, and the areola are left as they are, and I remove the breast through an incision underneath here. And then the plastic surgeon comes in and puts the implant in. For lumpectomies, I use something called a hidden scar technique. So most cancers of the breast can be reached through an incision just along the edge of the areola. If I can't do that, I'll place the incision either in the axilla or the armpit area, along the side of the breast here, or underneath here. So in those cases, the incision is going to be pretty well hidden, either in an area that's just not as visible within one of your natural skin folds, or it's going to blend in with the edge of the areola. Once that's done, I can release some of the remaining breast tissue from the chest wall and pull it together so that it fills that defect that was left by removing the cancer. So there really are a lot of options for women with breast cancer. The most important thing is obviously removing the entire cancer completely. The second most important thing is making sure we provide a good cosmetic outcome. And I do that by using some of these techniques.
All right, we've come a long way then, haven't
Yes,
we?
absolutely.
Dr. Stork, thank you so much for your insight today.
Thank you.
All right, this was your Genesis Medical Moments. For more information, go to ourquadcities.com and click on the medical tab.